They just fucking ended Medicare Part D. As of the last day of 2026, it's gone. Seniors will not have access to affordable medications, prescriptions. Gone. Overnight.
Y'all sent me that video several times in a panic asking me, is Medicare Part D, which is the program for seniors to pay for prescription drugs, is that actually ending? Did this administration destroy that program? And y'all know I try not to fearmonger and stick to the facts. And I want to be fully transparent here that Medicare Part D is not ending, right? That's not exactly what happened. However, as an economist who studies how we pay for healthcare, I want to go through the details of what actually happened because there could be some serious ramifications down the line. So yesterday, the current administration announced that it was ending a 2-year program known as the Part D demonstration. Essentially, what this program was it provided subsidies for individuals to purchase health insurance plans on the Part D marketplace. And that made it so the premiums that seniors would be paying for their Part D prescription drug plans would be cheaper. Now, why was this program set up to begin with? Well, you have to think about what policy-wise has been going on at this time. The major policy change for Medicare Part D was the Inflation Reduction Act, which was passed in 2022. And this bill, among other things, greatly increased the amount of things that these prescription drug plans, which are offered by private health insurance companies, had to cover. For example, it capped insulin at $35 a vial. It reduced cost sharing of vaccines to zero. It also capped out-of-pocket prescription drug costs for seniors by about $2,000 a year. When you think about it from an economics perspective, right, from the health insurance companies that provide these Part D plans, they're looking at this from a financial perspective, seeing their costs, right? The amount that they have to pay for people's health care rising. And so in response, they then increase their own prices. So the concern, right, is that these private health insurance companies would increase their premiums to the point where seniors would no longer be able to afford prescription drug coverage. And then they would drop off of their plans, and then that would increase prices, and it would create the potential for insurance unraveling, which we've talked about several times in prior videos. And so what this demonstration offered to do is that as insurance companies got used to the costs of these new plans, they would offer subsidies for seniors to purchase of prescription drug plans in order to make sure that the market was stable. However, for the 25 million Americans that currently are on standalone Part D plans, this program is ending. And this administration states the reason that they want this program to end is because they don't want the subsidies to go to private health insurance companies and for them to jack up the prices. This administration has also said that they expect that people's Medicare Part D premiums will either stay flat or go up by about, at the most, $20 a month. However, if you are a senior on a fixed income, you might not have $20 extra a month to afford. And so that is a big concern among policymakers, especially given some of the other choices, right? Because if you cannot afford a Part D plan and the increase in premiums is significant enough, it might encourage seniors to switch from standalone Part D plans onto Medicare Advantage. Even if seniors are able to afford the increase in the cost of premiums, the economics for these private health insurance companies to exist in the standalone Part D market without these subsidies might cause them to leave the insurance market altogether, which could then also increase the prices of premiums for the plans that are left, potentially unraveling the entire Part D market, which, if there are no standalone Part D plans left, or very few, seniors again might move towards Medicare Advantage. Medicare Advantage is essentially when you are getting your Medicare coverage through a private health insurance company. And oftentimes these Medicare Advantage plans wrap in prescription drug coverage at a no or very low premium. However, the concern, right, is that a lot of these Medicare Advantage plans tend to have higher deductibles. They require enrollees to pay co-pays and co-insurance. They also have high rates of prior authorization, right? Where you have to wait for the health insurance company to tell you whether or not you can receive care. The concern, right, is that the ending of this demonstration and the ending of these subsidies prematurely without allowing the Part D market to stabilize means that a lot of enrollees will be moving to Medicare Advantage plans where ultimately the costs for them will be higher, right? And we know from economic studies that the overpayments and overbilling by Medicare Advantage private health insurance companies lead to an increase in premiums for seniors over time. And so by not allowing them to stay on these Part D plans, they are pushing them into this environment that they might not necessarily go to by their own choices. I find it really interesting that this administration is making this argument that we are taking back and clawing back money from private health insurance companies, because what we would expect, right, as health economists, is that private health insurance companies would make money in a different format down the line. And for now, that's all I got. But as always, if you have any questions, let me know.